My name is Angela Brown.
David Brown.
I'm the mother of 3 sons. I've been a massage therapist for over 13 years.
Well, I'm a truck driver now. I was 15 years in law enforcement before that.
I guess I'm just trying to live life in the healthiest possible way that I can. April 25th of 2011, Trey was pitching a baseball game and he took a line drive to the left side of his head. Because Trey is my little actor, I thought maybe he was overdoing his symptoms. So we just followed typical concussion protocol, iced his head, gave him Tylenol, and then sent him to bed. And he had a rough night and he started throwing up. He was in a lot of pain. The next morning I took him in to our doctor, and the doctor took one look at him and said he needed a CAT scan. At that point, looking at the screen while my son is still laying in the CAT scan, I can't even describe quite that feeling. The doctor said, well, what hospital do you want to take him to? Because he needs to be air flighted out. He had an 1.5 inch bleed into his brain. So we were air flighted to Sioux Falls, and he was in so much pain. They had a hard time controlling his pain, and on day 3 we were supposed to go home, and then the next day I just started having this bad feeling. They wanted to give him some more liquid painkillers, and I told the nurse I wasn't comfortable with it, but she did it anyway, and she walked out, and Trey sat up, said he had to use the bathroom, and it was hard for him to walk, and I got Trey set up on the side of the bed, and he kind of slid off. We get him back up on the bed, and I turn away and I'm saying something to David, and David said, "What is that noise?" And I looked back, and Trey had started his looping seizures. And so we called the nurses in, and for me it was like moments, but in reality it was hours, since they had taken him back down for another CAT scan, and his seizures went from looping into grand mal, and it got to the point where he had 3 doctors working on him, trying to get him intubated, and they tried to shoo us out of the room, and I refused to leave. David was in the hall, of course, just what do we do? And the doctors all turned towards me and said, "Call your family, your son is going to die." And so I did. I called my oldest son and said to go pick up his little brother and to get to the hospital, because we didn't know what was going to happen. And he was intubated for 24 hours. When they extubated him, when they brought him out of the induced coma, he was paralyzed on his right side, and he was just a mess. He was just a shell. So what followed was over 3 years of horror for a child. He had hypothalamic storms. He had them horribly in the hospital, and they never ended. If you Google hypothalamic storms, the outcome is not good for people. Usually it ends in death, and it's certainly unheard of to have gone for years afterwards. And what they are is just his body would spike a fever, and then he would just have terrible pain. His head would, I kind of wondered if his brain was swelling at that time, and because he would complain of his spine hurting, and he would just have horrific body pain. And talking with the neurologist, they say, no, that wasn't normal, but, nothing with Trey was ever normal. So we truck along. We tried over 18 different medications. We even saw a psychiatrist, but one medication made him very suicidal and violent. Most of them did. Most of the mood-altering medications had terrible side effects. They wanted him on high blood pressure meds, and that would make his blood pressure bottom out, or give him even worse headaches. And then at one point, about 1.5 years ago or so, maybe 2 years. Anyway, the neurologist's big bright idea was we were going to do Botox. So we did 24 shots in Trey's head and neck, and instead of working, it counterreacted with his body. And at that time, we had Trey on one mood-altering medication and one medication that was supposed to help with his body pain. And nothing was really working. Trey was starting in with Tourette-type symptoms. And we went to the neurologist, and he said, well, maybe that's just normal. Maybe that's just a pattern of his brain healing. And so let's increase this particular mood-altering medication that he's on. So now we're in the fall of 2013, and Trey is exhibiting Tourette type symptoms where he's whooping and ticking, and you know, we're trusting our doctor that this is normal. And Christmas hits, and then hell hits. Trey is we'll just be sitting there watching TV, and Trey's muscles will start to spasm. Just his arms and his legs will spasm. And then that gradually increased into full body. Instead of just the little spasms, it was racking pain. And I'm sorry, I have a very hard time talking about it because it angers me. Trey couldn't sleep because of the pain in his head. Nothing relieved it. Nothing relieved the body pain or the spasms. And I was calling his neurologist, talking with the nurse at least 3 days a week, talking with his regular nurse practitioner, you know, and all that damn neurologist would come back with was, oh, this is normal. Really? He's having muscle spasms to the point where he's posturing back from the pain. He would be frozen in a position, or he would curl into a fetal position and he could barely open his hands. He wasn't sleeping, and you're calling that normal? And I was on the phone, and I would scream at that nurse that something is wrong. I wanted an MRI, I wanted a CAT scan, I wanted blood work, I wanted something. And he wouldn't listen. That neurologist would not listen. I am so angry with that man. So we didn't know what to do for Trey. He was in so much pain. No one was sleeping. I was worn out, and I wanted an answer. I wanted to, and not once at that point did I think it was his medications. One night, Trey was very bad, and Trey did a lot of self-harm at this point, and it was always his face or the walls, and he was punching his face so hard that it was bleeding profusely. And so I called my mom to come over to watch my youngest child, and I drove Trey to the emergency room. And while there, the nurse practitioner asked if I'd ever considered medical marijuana. And I said, oh, hon, I'm way ahead of you. We have a trip booked next week. And we did end up having to send him to the emergency room because she was right. His neurologist needed to see this. So we ambulanced him to Sioux Falls, which is about a 2-hour drive. And his doctor, of course, never came in. But another neurologist cared for him and thought we should put him on 2 other mood-altering medications. And they were bad. Very, very, very bad. Come to find out, the one was actually increasing his hypothalamic storms because it's a barbiturate. And the other one caused Trey, that few days that he took it, I couldn't leave the room because he kept trying to kill himself. Every single time I'd get up to go to the bathroom, I'd come back and he's stabbing himself or biting himself or just trying some way. He no longer wanted to live. He came right out and said he wanted to die. What do you do when your 14-year-old says, I want to die?
Yeah, we decided to do a bunch of research on cannabis to find out the benefits and how it can help Trey, our son. Basically, we did a lot of internet research, of course, and stuff on TV. And then once we actually got out to Colorado, that's where our hands-on research really began. Talking to all the people out there that were just helpful and took the time to tell you exactly what cannabis is about and how it can help. And that knowledge alone was priceless.
And the first one we stopped at, we met with this lady who has lupus, and so she understood body pain. And she was so knowledgeable in cannabis, and she said, well, we could sell you this and this, and but really what your son needs is what my friend can give you. And she says, I never do this, but I'm going to give you my friend's name and number. And they gifted us with a bottle of oil. It was a 1-to-1 ratio. It's called Indiva. It was indica based for body pain, and it was a little miracle in a bottle.
And being taken to that laboratory and speaking with the scientist that had also suffered a brain injury when he was a kid. And this is what that strain was developed for. And to watch Trey's pain and his muscle spasms and everything just release after about an hour and a half when that finally kicked in, after just 5 to 10 drops. It was just amazing.
And so many people push the CBD only, and no, I'm sorry, but when you're trying to stop muscle spasms and to tell the brain to literally shut up, you have to have THC. And these people, this is what they do, this is their passion, this is their lives. These people are not in it for the money, they are in it for the care of the patient.
Yeah, I mean, he really didn't get any relief from any narcotic painkillers whatsoever. It didn't do anything, you know, and cannabis is what actually helped him. It's what brought him out, and, you know, it's compared to the pharmaceutical drugs that you get your hands on that are very highly addictive and very easy to go absconder on. So I would much rather be using a natural substance such as cannabis than anything man-made. Oh, this is night and day reaction difference. I mean, you know, you give the kid a pharmaceutical and he was either snowballed or whatever, and you gave him cannabis, he was happy, he was able to do stuff, you know, and take him back out hunting and everything else. And I mean, it was great. With the addictive properties of, you know, narcotic painkillers, there's no comparison. I mean, there's no overdose, there's no catching.
It's such a minimal amount of people that could possibly become addicted to cannabis. It's a very small window, and those people would most likely become addicted to other things as well. Prior to all the legal things that went on, that are still going on, Trey was just consuming the drops via his mouth. We would just literally drop the drops into his mouth, and then he would drink a glass of water afterwards. If we wanted the cannabis to get into his system faster, then I would have him hold it under his tongue so that it would get into the bloodstream faster. With anything, you need to document, you know, how many drops he was having, how long it took, what the effects are, and how far apart in hours we needed to do them. It's quite the process, but it's worth it in the end. After we had started the oil last year, I was turned in because the state that we live in, it's still illegal. Their laws will not come into effect until July of 2015. And so I am facing charges. I had 2 gross misdemeanors kind of shoved in my face. And so not to get into the whole legality of it all, but of course we cannot continue to treat Trey while we are still in Minnesota. And he did slip right back into that serotonin syndrome. And shortly after that, I did realize it was his prescribed medications causing the serotonin syndrome. I took him to finally, after a 4-month wait, got him in to see his neurologist. And he says, well, maybe, I don't know, and blah, blah, blah. He just really was just pulling stuff out of his, yeah. And so another 2 more emergency room visits, and I got a referral down from our nurse practitioner, a referral down to the Children's Hospital in Aurora, Colorado, and took Trey down there and discovered, yes, he was on full-on serotonin syndrome from his prescribed medications, and we weaned him off. And so life is obviously better since then. And it's not normal to be in that length of time. Again, serotonin syndrome is something you hear of couple days, but he was in it for months.